everyone, this is Group 2 from SPCE 689, Section 817. Today we will conduct a case presentation to review a child named Jonah. But before we begin, we wanted to introduce each group member quickly. Today we have Mallory Sorrellis, Elizabeth Johnson, Lauren Carl, Clara West, and Shanna Jarvis. All right, Lauren, go ahead and take us off.
Okay, we're going to begin by discussing our child, Jonah. Jonah is a 3.5-year-old boy recently diagnosed with autism spectrum disorder. He has no other diagnoses at this time. He was evaluated for autism by a psychiatrist when his mother noticed that he lost communication skills. He has some language, including the words mama, no, and cup. However, mostly communicates by grabbing the hand of his caregiver and leading them to the item or standing by the item and crying. Jonah is not potty trained and currently wears a pull-up. He cannot dress himself. He can't button buttons, tie shoes, or zip zippers. His caregivers have concerns about hygiene skills as teeth brushing and bathing are extremely aversive. Jonah will engage in parallel play, but does not interact or initiate play with peers. He often sits on the floor, lines up blocks or toy cars by color, destroys the line, and starts again. He has limited imitative skills, meaning he does not copy the actions of others. Jonah engages in self-stimulatory behavior, which means he engages in behavior to stimulate his senses. This behavior manifests as rocking when in a sitting position, hand flapping, and spinning in a circle with his arms out. Jonah has never participated in any prior therapies, and his parents are seeking immediate ABA services.
We are going to take a minute now to compare two verbal behavior assessments. The first one is the VB-MAP, or the Verbal Behavior Milestones and Placement Program. This assesses language and learning skills in children with autism or other developmental delays for ages 0 to 48 months, or this developmental level. The assessment is sequence-based on what typical developing peers are able to do at the identified ages. It also identifies barriers to learning, including sensory sensitivities, attention difficulties, and behavioral challenges. The results are then used to guide treatment programming.
The second assessment is the Assessment of Basic Language and Learning Skills, or ABLES-R. It's an assessment tool used to assess those from birth to 12 years of age, but is most often used in children from 2 to 6 years of age. The 544 items across 44 repertoires determine various skills, including language, social interaction, self-help, academic, and motor skills. Each domain is broken down further, with each subdomain comprising of 6 to 57 items. The assessment identifies and tracks both strengths and weaknesses that can be used to individualize goals for a client to work towards.
We chose the ABLES-R assessment over the VB-MAP assessment. Due to our client's current area of needs, we thought Jonah would most benefit from the ABLES-R assessment. Based on the parents' report, they mentioned that Jonah struggles with several self-help skills such as toileting, dressing, toothbrushing, and bathing. The ABLES-R has a specific section that addresses self-help skills, allowing us to help target these skills more closely. On the other hand, VB-MAP does not allow for the targeting of self-help skills and instead has a higher focus on communication skills. The ABLES-R will allow us to still target Jonah's communication skills and growth within this area, as it also has specific communication building sections. There's also mentioned that Jonah wants to work on building his play skills, of which the ABLES-R has an entire section dedicated to play and leisure skills, as well as socialization building skills. This will allow us to work on building Jonah's skills during his playtime, such as learning a variety of ways to interact with toys and how to begin to interact with peers that are his same age. Although the VB-MAP does allow for us to target some of Jonah's needs, it does not allow for an all-encompassing assessment to target each of his needs mentioned as the ABLES-R does, which is why we believe it to be a better fit.
Now that we've discussed why we selected the ABLES-R, let's discuss the testing timeline, what we're hoping to conclude, and the next steps for the family. With this assessment, it will take 3 to 10 hours, and we will determine the skills and weaknesses that Jonah exhibits. We will use this information to develop goals to introduce to Jonah and his family. The next step for Jonah's family will be to collaborate so that they can help decide which goals for Jonah are important, such as the daily living, communication, social, and relationship skills. Our goal is to provide parent trainings every 2 to 4 weeks. In these, we will role play with Jonah's parents to teach them how to continue to work effectively toward goals and how to record necessary data when a therapist is not present. This data will include the data from skills that we are trying to develop with Jonah and any challenging behavior that he might be exhibiting for his parents. We will work on teaching the parents how to collect ABC data surrounding the challenging behavior. This means recording what happens before the behavior, the actual behavior, and what happens after the behavior. The ABLES-R will update every 6 to 12 months, depending on Jonah's progress and needs. Regular reassessment helps to track skill growth, identify new areas needed, adjust intervention strategies, and based on the information from parents, observation, and medical records provided, ABLES-R will be the most effective in identifying the needed goals to implement a successful intervention plan and to support the family and Jonah. Thank you for watching our video.